Hello, Dr. Michael Gorman, physical therapist here, and today is special because I get to be a patient today. How cool is that? So, quick story. I've started doing some yoga, get a little bit more flexibility. Today is Tuesday. I did a yoga class on Sunday, and today my hamstrings are so sore I can barely move. So I thought, what a good idea to get a little bit of treatment and show you all what we're doing here in the clinic, which is very unique to this area. This is called Winback Tecar. And Tecar is a form of treatment that's been in Europe for 30 years. It's in 40,000 clinics in Europe, and in the States it's been here for 5 years in about 200 clinics. So, very unique to us. And I'm gonna have Tara, our PT assistant, she's gonna be doing treatment on me, and I'll kind of be talking through, but we're gonna do about 4 minutes of Winback Tecar on each leg. And this is high intensity electrical current. Driving energy into the body to help with healing of the tissue. So for me, it's the hamstrings on both sides, kind of like medial hamstring on both sides. So that's the area. So I'm gonna be a patient.
Yeah.
Have fun. All right, I'm gonna get on my stomach. All right. Tara's doing it, but so as I said earlier, this is high intensity electrical current. So we're driving current into the area, using what may look like an ultrasound sound head, but it's nothing but that. This is an electrode, okay? And so what Tara just did, she put a return plate. So we're creating an electrical circuit, so we need to close that circuit. So we have this return plate underneath my thigh, all right? And so she's gonna have an electrode on the handle, and that electrode is gonna submit the current down into my hamstring. All right, she's going to grab some lotion because we have to have the lotion on there so the electrode has a medium to move through. Okay. All right. All right. So what's really cool about this, so cool is that, this is weird talking through a hole, but I guess I'll do it anyway. What's really cool about this is this unit does not generate heat. It uses electricity. But the resistance of the tissue in the body is what starts to generate that heat. Okay? And so we tell the patient 0 is cold and 10 is burning the heck out of you. Well, we don't want cold and we don't want to burn the heck out of you. So we're looking for a range of like 4 to 5 out of 10 on the warmth scale. Okay. Right now it's probably 3-ish. Yeah. And so she's just moving this electrode around. Okay. Moving the electrode around. Now, what's really cool is that we can implement some manual treatment with this as well, and by that, I can't see how Tara's holding the handle, but Tara, are you holding the handle with your hand on the electrode, or are you just holding the handle?
I have it on the electrode.
Okay, good, yeah, so you got your hand all over the electrode, so she's doing a little bit of manual hands-on treatment at the same time. And she's going to be working through this hamstring. So why am I doing this? Well, I have significantly tight, sore, inflamed hamstrings from yoga I did 48 hours ago. And this is a great treatment for this. And then tomorrow I'll be able to do a video where I tell you I felt great or didn't do anything. Right now I don't per se need that. I need to kind of calm the area down because it's so doggone tight. Okay, so we're doing 4 minutes on each side. I'm going to get my full treatment today. I don't want to be shortchanged. We never shortchange at iMove PT. So yeah, I started doing yoga because I'm 55 now, and I definitely, I've never been the most flexible person, but it's definitely gotten a little bit worse, and I love golf, and I've seen that my flexibility in my spine is decreased. So I've done 2 classes of yoga, and I will continue to do it. But I'm not so sure I was in a beginner class. I was doing things that the other people could do, and I could just kind of smile and look at them.
You gotta start somewhere.
You gotta start somewhere.
You'll figure out your place.
Yeah, that's right. That's important. We all do have to start somewhere, no matter where we are. We have to start somewhere with any exercise or rehab program. Yeah, Still about a 5 out of 10 on the warm scale. Yeah, so I definitely, I wouldn't go any higher, but I think it's great where it's at. All right, so she's probably almost done with the left leg. I don't know. I've been doing this a long time. I just know time. I don't know. All right, we are back, and now I've got Tara working on the right hamstring. So again, we're doing, it's called Winback Tecar. Tecar is the manufacturer. The treatment is called Tecar is the treatment, Winback is the manufacturer. So with Tecar, we talked a little bit earlier about what we're trying to do here, but we're driving an electrical current into connective tissue. When we have an injury, whether it's just maybe soreness after a hard workout, or maybe you were in a car accident, or you had a fracture, or whatever type of trauma you have inflammation from that, and the collagen in the injured area, all of a sudden, it doesn't lay down nice and quiet as it would like to be. So we get a lot of fibrous cross links in the collagen, and that restricts movement. So as the body generates the heat from the current going through it, those collagen fibers, those cross fibers that are not healthy for us, begin to dissolve away, okay, allowing better movement of the collagen, of the muscle, of the joint capsule, whatever it is that we're trying to work on here. Okay, so that's a beautiful thing about Tecar and what we're doing here. Contraindications, I think it's good to talk about that. Who can we not do Tecar on? Well, if you're pregnant, we will not be able to do Tecar on you. If you are under age 18, because of growth plates and things of that sort, we won't be able to use Tecar on you. If you have active cancer, we will not be able to do Tecar on you. And then also, if you have a pacemaker as well, unfortunately, we won't be able to do Tecar with you. But outside of that, there is no contraindications. We can use this for people that have total knees and total hips. There's no contraindication to that. We can actually use it on people that have had fractures as well to speed up the healing process of the fracture, because we're using electrical energy. All right, well, that's probably more than you ever want to know about Tecar, but I'm going to shut up so I can enjoy these next 2 or 3 minutes, and then what we'll do is tomorrow we'll be back at you. I won't be laying down on my stomach, and I'll let you know how I feel. Thank you.